As far as treatment is concerned, treatment has made this, the way that we understand treatment assumes that, generally, that it's targeting an underlying abnormality or disease. So, of course, we've been inundated with this idea that antidepressants rectify biochemical imbalances in serotonin or other neurotransmitters, as in these advertisements, and it's all over professional literature as well. And you're well aware that that's been associated with a huge increase in antidepressant prescribing. But there are ways that antidepressants might work, for inverted commas, or might appear to be different from a placebo that are not dependent on them targeting an underlying disease or abnormality. And a lot of my work has been trying to think about other ways that drugs might be working when we give them to people with mental health problems. And I've proposed that in contrast to this idea that the drugs that we give correct an underlying abnormality, they might in fact be inducing an abnormality or an alteration in mental functioning. All the drugs that we use for mental health problems are what we might call psychoactive drugs. They're drugs that change brain functioning. So if you give them to animals or people who don't have a diagnosis, there will be some change in the way that they behave and their emotions and their perceptions. And what I've been saying is that these changes are going to affect the way that mental health problems manifest themselves in ways that might be useful or might appear to be useful. So if you think of the use of antipsychotics or major tranquilizers, as they used to be called, for people with psychosis, this is the idea that what these drugs are doing is slowing people down, reducing people's emotional arousal and emotional investment in their experiences, and therefore making them calmer and sometimes better able to function. So these drugs are not rectifying an underlying abnormality, but producing alterations that may be helpful. Of course, we shouldn't forget that there are placebo effects which affect the result of trials, and any drug that has noticeable effects will have amplified placebo effects. So in fact, if we look at drugs like antidepressants, the difference between an antidepressant and a placebo is very small. It's only a couple of points on a scale. The Hamilton scale is 54 points. And it's a couple of points which may well be explained by amplified placebo effects. In order to use drugs for mental health problems intelligently, therefore, and to understand what they might be doing, we really need to know what sort of alterations they produce. And there's been very little work on this, which is just a demonstration of how all our thinking has been within that model of seeing drugs as disease-targeting treatments. We've not been interested in the sort of alterations that they might be producing. But actually, there's a little bit of research that we can use to find out about these alterations, and we can also ask people who've taken this sort of medication. We know that tricyclic antidepressants, for example, are profoundly sedating substances, which cause slowing on the EEG and slowing up of cognitive responses and reaction times, and may therefore be useful if people are experiencing severe insomnia or anxiety. SSRIs appear to be much less strong in the alterations they produce. And while on the one hand they do induce some lethargy, some reduced activity, fogginess, loss of libido, that's well documented, their sexual effects. They also, in some people, seem to cause tension and anxiety and agitation. They seem to, many people describe that they cause a feeling of emotional numbing or disengagement, which may well reduce feelings of depression, but also people say reduce feelings of happiness and positive emotions as well. So the question that I think we should be asking ourselves when we think about drug treatment is, you know, what sort of alterations do drugs produce? What sort of effects are they going to have on someone who is depressed or anxious or in distress of some sort? And will those, you know, might those effects be useful? But even if they're useful long term, short term, what sort of long term effects do they have? What's the balance of pros and cons? Those are all the things that I think we should be thinking about.